Sir, I have a little question. You are very right about the desensitization and all, but don't we think that it'll affect the doctor's life too? Like if they come home and they're still in that phase of mind, the grief and all, wouldn't it be affecting his life too? Matlab, uh, the next day when he goes to the hospital, I don't think he'll be able to cope with the situation that well.
Thank you. Thank you for asking that question. See, when we as non-doctors or as medical students, not desensitized yet, when we attend a funeral or when we are with a grieving person, we're not as sad. We are not as broken. We are not as overwhelmed as they are naturally, which is why we're in a position to help them through that time. One of them may be in shock, not knowing what to do. And we are sad for them, and we may have known the deceased as well as an uncle or an auntie or as a friend's father or mother. We may have shed a couple of tears ourselves. Nevertheless, the degree of emotions is not that much that we're shocked into like inability to do anything. We still can do a whole lot more than they can in that situation. And so we help. And that comes from a place of caring and concern and not being desensitized. So bringing from that analogy to the medical profession, will the life of that doctor be affected as he goes home, as he goes the next day to his clinic? To a certain degree, yes. And it should be. But if it is to the effect of rendering them incapable of performing their responsibility, of their duties, then yes, that's a pathology. But an equal degree of pathology is when it is not affecting them at all, to the point that they cannot express basic empathy to their patients, that they are rude, that they're unethical, there is illegitimate polypharmacy going on, there's tests that should not be done that are being done, that they are passing on the worst news that the patient has ever heard so casually. Yeah, that's a bigger pathology. That's a big, so somewhere along, we need to strike a balance. As a community, we need to be concerned about, as a community of physicians, a community of healers, we need to be concerned with developing that balance. Because if we're not, then there is something seriously wrong. And that's, we're sick. We're sick. The entire community of sick doctors, mentally sick.